Hello, I'm Phing Saurer, a general dentist at River Park Dental in Dublin, Ohio. It is important to both myself and my team that we make dentistry simple for you to understand. Today, I'd like to provide answers to 32 of the most frequently asked questions I have received. Let's get started.
What is the difference between a DMD and a DDS? Are they both dentists?
The DDS, which is Doctor of Dental Surgery, and DMD, Doctor of Dental Medicine, are the same degrees. Universities determine what degree is awarded, but both degrees use the same curriculum requirements.
How long did you go to school?
Dental school takes 4 years after you complete a bachelor's degree, which totals 8 years. I went to school for 12 years because I completed both my DDS and my PhD at the same time.
When should my child first see a dentist?
Come see us whenever you have a concern or by age 2. I offer care to infants as young as 4 days old. Sometimes children are born with a tongue tie and have difficulty breastfeeding. 2 of my 3 children have gone through this, and I completely understand the frustration. I am able to provide relief to their symptoms by performing a quick laser treatment in my office.
When will my child get their first tooth?
While the average time for the appearance of first teeth is between 5 and 7 months of age, there's a wide range before and after that can still be considered normal. Teeth can come in as early as 1 month of age, or they may erupt when the child is 1.5 years old. Generally speaking, at around 6 months, the lower teeth come in first, and girls' teeth typically erupt earlier than boys.
Should every child get sealants?
The American Dental Association recommends that children receive dental sealants as soon as their adult teeth erupt. Dental sealants are a quick, easy, and relatively cheap solution for preventing cavities. They are a thin coating that's applied to the biting surface that helps prevent bacteria and other debris from getting into the deep crevices on the tooth. Young children are great candidates for preventive measures like sealants because in many cases, decay has not set in. Children's teeth tend to benefit more from sealants because these pits and grooves tend to be deeper and less calcified than they are in adults. We all know that kids are generally not the best brushers and tend to ignore the problem areas in the back of the mouth that leads to cavities and decay.
Are x-rays safe for children?
We have digital x-rays in our office, which have 90% less radiation than film x-rays.
Do children have to have fluoride treatments at your office?
Bacteria in the mouth combine with sugars and produce acid that can harm tooth enamel and damage teeth. Fluoride protects teeth from acid damage and helps reverse early signs of decay. New guidelines by the American Dental Association suggest that parents should use a tiny smear of fluoride toothpaste to brush baby teeth twice a day as soon as they erupt. Once children are 3 to 6 years old, then the amount should be increased to a pea-sized dollop. Just make sure they can spit out the toothpaste.
Should my kids wear mouth guards when playing sports?
Safety is a super important part of oral health. We recommend all children wear a mouth guard if they are involved in any sport or activity where they come in contact with other players or hard surfaces.
I have a great fear of the dentist. What can you do to help me get through?
You are not alone. Dental anxiety is extremely common. We have several options to help ease your anxiety. Depending on your needs, we provide nitrous oxide, oral sedation, and IV sedation.
How often should I see a dentist?
2 times a year for preventative care. It's 1 hour every 6 months. Make it a priority. We always love seeing you.
How often should I floss?
At least daily, please. But if you want that piece of steak to hang out in there for the next few weeks, that's fine too.
Which is better, manual or electronic toothbrush?
If a manual toothbrush is used for the appropriate amount of time and done with proper technique, it can perform just as well as a powered toothbrush. Many people don't brush for the recommended 2 minutes. I lean towards electric toothbrushes. Why not let it do the work for you?
What causes bad breath and how can I get rid of it?
While bad breath or halitosis can be linked to numerous systemic diseases, the majority of bad breath originates in the mouth. A dry mouth or a low salivary flow can also influence bad odor. There are 2 main goals in the management of bad breath. First, controlling the bacteria that produces the sulfur compounds, and second, to neutralize the sulfur compounds that are produced.
Why do my gums bleed?
The main cause of bleeding gums is the buildup of plaque at the gum line. This will lead to a condition called gingivitis. Plaque that is not removed will harden into tartar. This will lead to increased bleeding and a more advanced form of gum and bone disease called periodontitis. Bleeding gums can happen for a number of reasons. We recommend brushing and flossing regularly and seeing your dentist every 6 months.
I'm not having any sensitivity or pain in any area that needs a filling. Why should I fix it now?
I get this question all the time. Most dental problems don't have any symptoms until they reach more advanced stages, so please don't wait for things to hurt. It is best to get a thorough dental exam and diagnosis and treat problems early. Waiting often makes problems more difficult and more expensive to fix.
What is a crown buildup?
A buildup is a filling that is done on a broken tooth to give the tooth enough body to make a crown.
Where and what are crowns made of? And why do they take 2 weeks to make?
We make same-day crowns in our office. Our crowns are made from a single block of high-quality ceramic. This is a top-grade material that has been harvested for its toughness, durability, and aesthetic qualities, which makes it a highly prized crown.
Once I have a crown placed over my tooth, how long will that last?
To answer how long a crown should last is hard to determine due to several factors: material, location, how much tooth remained when prepared for a crown, bite forces, and hygiene practices. Most insurance companies will pay every 5 years for a crown, meaning they aren't surprised if the crown should be redone. Most crowns average 10 to 15 years, and many people have crowns in their mouths for more than 25 to 30 years. Mileage does vary.
What's a root canal?
Contrary to popular belief, root canals are not meant to cause pain. It is a procedure to remove bacteria and dying or dead tissue from inside the tooth.
I'm missing a tooth and I'm ready to replace it. What are my options?
There are several. You can get a dental implant placed if there's enough bone support. You can also get a bridge which crowns the two teeth next to the space. A removable denture is also another option.
What is the process of a dental implant? How long will it take until I'm back to normal?
Once an implant is placed, there is a 3 to 4 month healing period before a crown is placed. In some cases, I can immediately place an implant and crown so you don't have to walk around with a missing tooth. If you knock out a front tooth, I may be able to replace it, depending on the damage, that same day without anyone noticing.
Do I have to be sedated for oral surgery?
No, you don't have to be. Many people do well just with local anesthetic. But if you're concerned about anxiety, then we have several sedation solutions for you.
I want to be knocked out. What types of sedation do you offer?
I can make you comfortable under oral or IV sedation.
Only one of my wisdom teeth bother me. Should they all be removed?
It depends. We will have to take an x-ray and evaluate how your teeth are erupting and if there's room for them.
I don't like the shape of my teeth. Help!
There are several different options available to change the shape of your teeth. You can choose to make your teeth look longer, close spaces, or repair a chipped or cracked tooth. Among the options are bonding, crowns, veneers, and recontouring. We can discuss all your options in depth during our cosmetic treatment consultation.
If I get veneers, will I have to be careful about biting into food?
Veneers are a great option for changing your appearance, but they are not maintenance-free or unbreakable. Things that can damage a natural tooth will damage a veneer as well. Veneers can last for a long time if they are properly done and well cared for.
Can you veneer just one tooth and still have natural appearance?
Doing one middle tooth by itself is about the toughest thing we encounter for cosmetics. The two middle teeth should be as close to identical as possible, or the smile tends to not look right no matter what we do. It's not impossible, however, if the rest of your teeth are light in color. I usually recommend that my patients bleach first. It makes doing one a bit easier.
What can you do to avoid tooth staining?
1. Drink with a straw. This will help keep stains away when you drink soda, juice, coffee, or tea. 2. Brush, floss, and rinse with an antibacterial mouthwash. 3. Get your teeth professionally cleaned. 4. Don't use tobacco. And 5. You can use at-home whitening kits.
What whitening procedures do you offer?
We have pre-filled trays that you can use at home. We also make trays that are custom to your teeth, and you can fill it with different strengths of whitening gel we provide. If you don't want to do it at home, we can also do it in our office.
I want straight teeth. What are my options?
Depending on what needs to be done, we offer traditional braces as well as clear aligners.
I don't have orthodontic benefits. Can I still get treatment?
Absolutely.
Why would a dentist offer Botox?
Dentists are very proficient in giving injections. We give thousands a year. We are also the specialists in the oral and maxillofacial areas. We are very knowledgeable in the muscles of mastication and the muscles of facial expression, which routinely receive these treatments. Botox can help with cosmetics, such as smoothing out wrinkles or lowering a gummy smile. It can also be used as an adjunct for DMD treatment. Well, that completes our 32 most frequently asked questions. For more information, visit riverparkdental.com. We'll see you next time.